My name is Bob Oman. I'm a former member of the Chesapeake Hospital Authority. A lot of you knew my father, who was mayor of Chesapeake for 3 terms and also served on city council. During the time that he was serving his elected office, he was diagnosed with prostate cancer. And you have to bear in mind, in those days, the only facility that we had was at DePaul Hospital. So it took Dad an hour to get to Norfolk, and then an hour to get back, and that was without any kind of traffic. So day after day for 30 days, he had to do that. And I think as he went back and forth, especially when he was sitting in traffic, he started fuming a little bit and asking the question to himself, why in a city as large as Chesapeake do the citizens, my family members, my neighbors, and everyone have to go to another city when they're trying to battle cancer?
We saw a real need for a local cancer center, and we teamed up with the great Sid Oman, and he was instrumental in cutting through red tape in Richmond, got us our certificate of need, and built an on-site radiation center. I can remember it vividly, actually doing the blueprints with Don Buckley and the architectural firm, mapping it on out and actually seeing on paper, okay, this is gonna be the cancer center.
The process and design of the cancer center goes back in time when we had first developed a strategic plan and wanted to implement it. And I want to say something very clearly. The governing board prioritized the cancer center.
When we started with the expansion of the priority Toyota Cancer Center several years ago, during the design phase, one of the things that were most important to us and to our strategic vision for our community was to create a comprehensive cancer center where patients in our community would have the opportunity to receive all of their oncology care in one location, from diagnosis all the way through remission and recovery.
They say that you, like father, like son, and a couple of years ago, unfortunately, I was diagnosed with prostate cancer as well. But I remember first going into the cancer treatment center, and it had recently been redone, and it was gorgeous in there. My dad was so proud of the fact that we had a cancer treatment center that it didn't matter to him whether his name on it. He wanted it to grow and flourish. And I saw the schematics of it, and it was looking great. And so I thought, you know, Dad would be so proud about this.
The past is prologue. It's important to acknowledge the past. It's important to acknowledge the people that have come before you. And Mayor Oman, of course, was one of those persons. And now, anyone that goes into the cancer center can read the story.
We have a state-of-the-art facility with a great cancer group and just an amazing array of technology to really helping prevent and really diagnose and treat patients to the fullest extent possible to give the best possible outcome.
All of the wraparound services that are needed for oncology patients to include social services, support groups, dietary and nutrition consults, infusion services, radiation therapy, stereotactic radiosurgery, our very own physical therapy department for oncology patients, our lymphedema clinic, which is housed within the cancer center, palliative care, both inpatient and outpatient program with offices also inside the cancer center. We also built a multi-specialty clinic space where multiple disciplines can see a patient in one location, minimizing travel for patients and families.
We've got the best of both worlds. We've got the great facilities that are attractive and state-of-the-art. We have great equipment, and we have that element of people that are serving people, and they're doing it in a way that makes it very easy to be able to fight cancer, something that's not easy to do.
I'm really proud of our cancer center. I'm proud of what we've created because it's closer to where people live and it has all of the modalities in the building.
It makes me very proud to go into the cancer treatment center now. It has evolved a lot and it has expanded a lot. And to go in and see it on par with other larger hospital groups in the area, I mean, I feel like that we are, at least on par, if not better.